Now, folks are not just emptying their bank accounts because of an immoral system, they're also getting sick and dying just doing their jobs. Since the pandemic erupted, I've been covering regularly how workers in many jobs are getting sick and dying because they are forced to go to work. Forced mainly because millions of people don't make enough money to build up an emergency cushion, so sick or not, they need the paycheck. And we don't have, like many civilized countries, paid sick leave. So it puts even more pressure on an ill worker to show up and unfortunately then infect other coworkers. And making matters worse, employers really haven't given a damn about creating safe working conditions during this pandemic because, after all, it's all about making profits, not human life. Now, the only time when working conditions have improved is when workers challenge the dangerous conditions that they were being put in. The poultry industry is one of the worst examples of the carnage workers are going through. Now, I've written about and looked at the poultry industry for a very long time because it is a cesspool of greedy corporations exploiting people in some of the worst working conditions you can find, and that's on a quote-unquote good day. Cramped spaces, bad air, bacteria everywhere, and just an epidemic of injuries, some of them lifelong carpal tunnel injuries and other afflictions. COVID-19 has simply exploited the chain of horrors that really has existed for decades in this industry. Just consider this. Low pay in this industry means workers have to be crowded into terrible housing conditions. They don't have enough money to pay for decent food, and they have very poor health care because they can't afford to go to a doctor. All of which are perfect conditions for a virus to latch onto, infect people, spread to a community, and become almost unstoppable. The virus simply takes advantage of what greed has sowed for decades. So to update us on what poultry workers are facing, let me bring in Alexandre Galimberti. Alexander is the Senior Advocacy and Collaborations Advisor for the U.S. Domestic Program at Oxfam America. And I always think when we talk about the poultry industry that we have to telescope back a little bit, Alex, to give some context. Because to me, we're really dealing with three viruses combined. One is the virus of greed. One is the virus, if I can say, of capitalism. And then one is the coronavirus. And they've all sort of melded together here to create this horrendous situation, which I've covered on this show several times since the pandemic began. As you well know, on a good day, meaning absent the coronavirus, the poultry industry was a horrible place to work, right?
Yes, correct. So that's precisely, I think, the genesis of the crisis that we're dealing with what poultry workers are experiencing, with what Oxfam has documented together with our partner organizations, that we're dealing with a situation that was already very bad to begin with. Poultry workers, poultry processing plants were already a really terrible place to work at because of the oppressive conditions. And I agree with you on the driving factors for that of greed. We saw this week on the report published by ProPublica that the poultry industry knew for years that they were vulnerable for a pandemic. They knew that the workplace had to be adapted. There needed to be preventative measures to make sure that workers could be protected. So Oxfam, our partner organizations, our allies have been saying for years that these workplaces are dangerous. Workers don't have a voice. Management practices are exploitative. Workers are getting hurt. Workers are being mistreated.
Mm-hmm.
And when this pandemic began, we tried to tell the industry right on the spot that they need to do something, that this pandemic is going to hit them hard. And they didn't do anything. They didn't listen.
So
They
let's
try to continue operating business as usual. And that, I think, is the big problem there.
And so let's, in fact, underscore business as usual. You've got these companies who are incredibly greedy and incredibly profitable. They're run by CEOs with basically a hard ass attitude where unions are very weak, where these companies try to bust unions and keep unions out. You've got, on, as I said, on a good day, these workplaces that are crammed together. You've got this intense intensity on the line of a huge number of these chickens in this case, and this is true in meat processing too, whizzing by where workers were crammed together. And as you well know, and I've covered this for a number of years, huge number of injuries, largely because of carpal tunnel syndrome and the ways in which workers have to make so many cuts in such a short amount of time that they end up with these disfiguring injuries and injuries, lifelong injuries that follow them for decades, even after they've retired.
Yeah, exactly. And this is really business as usual for this industry means exactly what they have been doing for decades, which is to try to exploit the cheapest form of labor possible that they can find and really deny the humanity of the people that are in the processing lines, ensuring that we have the readily available supply of chicken that we have. So if this is the way that the industry has been operating for decades, it is no surprise that when this pandemic hit our economy, they didn't bother to take stock of what needed to be done to protect their workforce, what needed to be done to protect the humanity, not only of the workers that show up day after day to process the chicken that they sell, but also the communities where they operate. Because when these outbreaks started happening and workers that work these processing lines were infected, this had a ripple effect in the entire community. These are communities where the processing plants that are in these small towns are oftentimes the largest employer in town. So if you see the largest employer having a large outbreak, this means that the whole community is impacted.
And I should have added one other factor that's quite important. You mentioned this in your important report, that the communities and especially the workers are largely people of color, largely immigrants and people with undocumented folks. And so they feel most vulnerable to the situation you just described. It's the best job they can get, and they're afraid to speak up because obviously of the consequences of standing up, even though they see around them. And now we're going to move to what's happening in this pandemic. They see around them their coworkers and family members getting sick and dying.
Yes, and that is also the the long standing climate of fear that lives in this industry. I think that the way, and you have been reporting on this, and so many outlets have reported historically on this industry, how the poultry industry, as it industrialized, as it became concentrated, vertically integrated into having a handful of companies controlling the almost entire industry. It has been by design that vulnerable populations have been the workforce. And it has been a historic transition. A few decades ago, the majority of the workforce was African American in the processing plants in the Deep South. And by design, this has been documented. The plants in Mississippi, for instance, intentionally switched their workforce from African American, the predominant workforce population in that state, to bring Latino immigrants to that state because the African American population started wanting to unionize and organize. So trying to always explore the most vulnerable populations in our workforce is something that is a recurrency in this industry. And we see that that's why in the pandemic and the scenario that we're in right now, the vulnerabilities of these workers make it harder for them to push back and say, we are not going to show up because we don't feel safe. And they feel forced to work because oftentimes some of these workers are undocumented. And if they do not show up to work, they are not going to get a stimulus check. They're not going to get an employment. So it's risk themselves to COVID or face hunger.
That's a fabulous point you made before, by the way, the transition in the workforce from African American workers who began to have the sense that they should have a union to Latino workers who are more vulnerable and feel unsure. So that's a fabulous point. So let's actually now dig into the specifics. Let's
Hmm.
talk about the specific things that you have found. And I've talked about this with the RWDSU unions before and folks that
Yeah.
have advocated on behalf of poultry workers. But let's dig into what are the specific things that are happening inside poultry plants that are specific to the poultry industry that are making folks sick, and actually many hundreds have died over, nationwide in those poultry pens. And I think my audience has probably read in the general mainstream media about these shutdowns of poultry plants that have happened because of the huge spreads of the disease. So let's talk specifically about those factors.
Yes, and I think this goes all to the biggest problem, which is while the majority of the economy had to take stock, had to stop production or descale production, slow down so that we could do the proper prevention, the poultry processing industry did not. So
Mm,
business as usual meant that workers were showing up to work and continue to be in very crowded spaces, working shoulder to shoulder, where it's impossible to have physical distancing. No worker in the processing line was having the luxury of have a 6 foot distance from their coworkers. They were working shoulder to shoulder on the line, across from other workers on the other side of the line. Um, the break rooms are crowded because they have to stop the line and all of the workers have lunch at the same time. Some plants uh, claimed to have started to stagger breaks, but still in a workplace where you have 1,000, 1,500 workers and they're staggering breaks, you're still having hundreds of workers at the same time in a small break room.
mm,
Bathroom breaks are also timed, so people have to wait in line, especially women. This is a huge issue for gender justice in this workforce. Women workers, they have to wait in line. Oftentimes there's not enough facilities in these processing plants, so they have to be crowded, waiting their turn to use a stall. And the entry, the sharing of equipment, tools, protective equipment that is offered to them is insufficient. We heard stories of immigrant workers in North Carolina that asked early on in the pandemic to get face masks, to get face shields, to get protection because they knew that this pandemic was a threat and their community was at risk, and employers denied that. And then
So,
that's what's really problematic.
so one of the things you said was that people are working shoulder to shoulder, and sometimes I think we use that as kind of a cliche, but it literally is true. When you say
Yes.
shoulder to shoulder, and I'm kind of motioning here, people are crammed together so closely that they're banging against each other because, from the standpoint of the poultry industry, they want to cram as many workers as possible into a small space in order to keep pace with the whizzing fast production line that's basically speeding those carcasses, the chicken carcasses, and they have
Yes.
to be many cuts have to be made in a short amount of time. So from their point of view, the most efficient, and I say that in a sarcastic way, the most
Hmm.
efficient way to run that line is basically cram people together.
Precisely. And that is something that has not been changed. The
Mm,
only change that poultry companies offered was to put a plastic curtain in between these workers. So these workers now, instead of having their shoulders touch each other, there's a plastic barrier between them, but the
unbelievable.
proximity is still there. And health and safety experts have said that this is not a sufficient prevention because the air is still going to go around that 1 foot plastic barrier, and they're still going to be breathing the same air.
Mm.
And air circulation in these plants is not is also an issue. That these workers are working shoulder to shoulder in stagnant air, and we know that they're working so close together that in previous reports, pre-pandemic, that Oxfam published, we documented that not only some of the frequent injuries they have, of course, the most frequent is carpal tunnel from the repetitive motion, but also they're standing so close together that it is not uncommon for a worker to accidentally cut a coworker that is standing so close to them while
Mm.
they're making repetitive motions to slice the
Incredible.
chicken.
And when you mentioned ventilation and it's stagnant air, I mean, the reason there's stagnant air is because it costs money to actually have good ventilation in these kinds of factories, these locations. And these companies are penny pinchers. They're really abusive. They don't want to spend the money that, again, in a good day, folks should have good ventilation because that keeps them healthier somewhat. Remember, there's a lot of germs and bacteria that floats around from these chickens and these carcasses on a good day, even before the pandemic,
Mhm.
and people get sick from that. So they don't care about that ventilation. Now, one of the things in the report that I think is also important to underscore is the companies essentially putting pressure on people to come to work even when they know that they're sick. And they're doing that some ways through these bonuses that they're handing out. They're saying, hey, if you continue to come to work, we're going to give you $500. If you
Yeah.
continue to show up, we're going to reward you. And that's this very subtle way in which they're exacerbating the situation.
Yes. So there are two different ways that we have documented and heard from workers through our partners that the workers are being pressured to go to work and put themselves at risk. And the first one that you just mentioned is the indirect pressure, which is corporately sanctioned through the policies that these corporations have put in place as temporary incentives for showing up to work, which are attendance-based bonuses. Some companies have announced bonuses that if you show up with perfect attendance for a month, a quarter, a certain period of time, you get a cash bonus for that period. The $500, that's a quarterly bonus, for example. Some of the plants gave an hourly bonus. You get a $1 or $2 an hour raise, but you only get that bonus on your hourly paycheck if you had perfect attendance for that pay cycle. So if you show up 4 days uh, uh, for your entire shift, and then on one day in the week you showed up late or you had to leave early because of a family emergency, then you lose your bonus for the entire
Mm.
week. So those are incentives for people to show up to work whether or not they're feeling well. So if a worker is on the line and they're starting to feel symptoms, they're starting to feel like they have a headache or they're developing a fever, they are going to do everything they can to not be noticed, to not tell the managers that they're experiencing symptoms, because if they are sent home, they lose their bonus.
And let's be
Now,
clear, for those folks, the reason they stay at work is partly they don't have paid sick leave. And that's true not
yes,
just in this terrible industry, but throughout the country. And specific to this industry, the wages are so low as it is that to miss work for folks that have no other options, as you point out, sometimes this is the only employer in town. That's very frightening because the only other option you will have is either unemployment or maybe working at the 7-Eleven.
correct. And also we have to take into account the families that a lot of these workers belong to. Many of the processing line workers that we interview are women, immigrant women, and in their households, they might have a spouse that lost his income because of the pandemic. Immigrant men that are working in construction, in other jobs in the service industry, and right now, because of the shutdowns, they have lost work. So the poultry processing worker in a household now might have become all of a sudden the sole income for an entire family.
Mm,
So the
mm.
pressure for them to do everything possible to not lose that income becomes much more elevated. And now the one other point that I was going to make about things that we heard from our partners, which is a more egregious way to incentivize or force workers to come to work when they might have been exposed or they're afraid of exposure to the virus is, and these of course are not corporate sanctioned policies, but we have documented instances where plant supervisors and plant managers are doing this. When a worker is exposed and is told to quarantine and they are told to take a test, they get a test that comes negative, but medical experts say that even if you got a test that was negative, you still should quarantine for 2 weeks before you show up to a crowded space like a poultry plant. But the plant starts calling the worker and say, can you come? You got a
Yeah,
negative test. We need you on the line.
yeah.
Or workers that tested positive, and as soon as they stop experiencing symptoms, they're told to go back to the workplace. And that is an egregious way to make workers come back to the workplace and put themselves and their coworkers at risk.
Okay, and in the last minute or so that we have here, and I want you to do this in a tight fashion,
Yeah.
I want to point out that poultry workers are essential workers, and it is a
Hmm.
great thing when people are celebrating, obviously, the healthcare workers, the nurses, the doctors, the people who are treating people who are ill, who come into the hospitals. But let's face it, there are essential workers on the front lines in retail stores, on transit systems, and certainly poultry workers. If everybody thinks for a moment all the chicken they eat, let's face it, without those folks putting their lives on the line, you don't
Yeah.
have your chicken in front of you to eat. Now, that may really be an argument for being a vegetarian, which I am, but that's a separate question.
Hmm.
What I want you to do is, in a few points, say, what's the solution? How do we change those workplaces to, at this point in this pandemic, make people more safe?
Yes. So one thing that Oxfam really strives to do is to make sure that these workers are not invisible, because that's the big distinction between essential workers that are healthcare workers, first responders, even retail workers. Comparing these types of essential workers with poultry processing workers, farm workers, food processing workers, they are the invisible
Mm,
essential workforce. They have always been essential.
that's
Food
a very
processing workers
good
have
point.
been essential way before a pandemic. They have always been essential, but they have also always been invisible. So at Oxfam, we want to make sure that the consumer public, the general public, understands the realities that they experience. And this is only possible, and I want to take a moment here to really shout out our partners that make this possible, the organizers that work in the ground and make it possible that we can listen to these workers and document their stories. Organizers in North Carolina, in
Hmm.
Texas, in the Delmarva Peninsula that meet with workers and documented what they do. And I want to name a few organizations, if you allow me. So the Western North Carolina Workers Center, they collaborate with us for many years. Centro de Derechos Laborales, an organization in Bryan, Texas. Rebirth Inc., a community Haitian organization in the Delmarva Peninsula. CATA, the Farm Workers Support Committee, that also operates in the Delmarva Peninsula, and Interfaith Worker Justice have been instrumental. So visibilizing these workers is the first thing. The second point is that the consumer public, especially the ones of us that choose to eat meat, and because of cultural reasons, heritage reasons, or just personal choices, we need to understand that we need to value the product and understand the value of the people that are producing this, especially in a moment of a national crisis, of a pandemic like this. I think the general public needs to be aware that we can't expect to buy chicken or other food products at the same price that we used to before. The real cost of the food that we eat needs to be taken into account, especially the human cost. And workers need to be well remunerated and ensure that they are kept safe in the workplace. And consumers need to pay that, and also corporations.
Well, we will keep after this story, Alex, and I appreciate your work, Oxfam's work generally, and please come back to the show and let us know how this effort to protect poultry workers is going. Thanks for being on the show.
Thank you, Jonathan. Thanks for your continuing reporting on this and continuously inviting Oxfam to be on your show.